Hi, guys. How are you? It's Dr. Pam, owner of Academic Coaching for World Changers, and I'm so glad that you're tuning into this video. I was perusing Facebook this evening, and I saw some Lmsw questions on the Code of Ethics. And I really want to help you understand the Code of Ethics. Welcome to our channel. If it's the first time that you have hung out with us, we are a very unique tutoring company. We only tutor to mental health exams. I'm a college professor with already 30 years of experience in the field, and I own and write so much material. If you're looking at test questions, I might have wrote some of them. The goal is we really want to teach you how to prepare for the test. I pray that your colleges have prepared you, but a lot of their colleges have not. I'm very aware of that. I wish someone had told me when I was a freshman that I needed to remember uh, what happened in Jane Addams and how HMOs changed. I wish all those things someone had told me. So I understand a lot of you are frustrated with the test. I'll understand that a lot of you are frustrated that your professors didn't provide. We can fight that for a different day, but today I just want to help you pass the test. So thank you for subscribing to our channel and thank you for watching this video. So the question that I really talked about was a code of ethics question. So I'm going to tell you again, we are one of we're the only company actually that does what we do. We provide individual and small group tutoring based on what you need. We don't sell canned programs. We think that most of you, and we know all of our clients are the 4.0, the A students, and you struggle with passing the test. It's not that you're not a good clinician. We don't make you a better social worker. We make you a better test taker. I will tell you that you are worth it. Invest in yourself. Invest in yourself. You're worth it. We'll get you this test one time or one more time. So, one of the things we want to start with is understanding the social work problem solving process. You might have seen Safari, eat pie, eat cake. I don't know. I don't want to do anything. I just want to remember what I learned when I was in undergrad and grad school. I took a class at both levels on how to understand the process. Remember, we assess, assess, assess. We get paid to be nosy. We're always going to start at that level, whether it's a first question, a next question, no matter what it says. I'm going to remind you, we get paid to be nosy. Assess, assess, assess. There are a couple of reasons when I can't assess, of course. Feelings trump that. If I'm crying, you're not going to start with your biopsychosocial. You're going to ask me how I'm doing. You're going to address my feelings first. And safety, of course, trumps all of that. My safety as well as the client's safety. That's always what we're going to do first. I don't think you need all of those steps. I don't have time to figure out how to eat pie. I don't. I just want you to understand. I assess. If I can't assess, that means that there's some things first that I need to deal with feelings and safety. I also want you to understand that we don't do a treatment plan without the client. We always work with the client, never without the client. And termination starts at the beginning. When you're looking at test questions, they're really focused on Bloom's taxonomy. Back in the day, and really some of our other programs talk about recall. Recall is just knowing this is a defensive mechanism. You're not going to find very many recall questions on the test. You're going to find higher application where you have to analyze and evaluate. So a recall question is what are Freud's 4 stages? You're really not going to find those. You really have to go just a little bit deeper than that to be able to understand and answer the questions. So understand Bloom's taxonomy. One of the other things that I want you to always remember, it is a reading test. It's a reading test. I know that some of the other coaches, therapists, educators out there say, just focus on the last lines. No, every single word they give you matters. Every word. They're not distractors. Every word in the question matters. It's like reading scripture. The woman at the well, the one with the issue of blood. It's in there for a reason. Every word matters. Don't just focus on those last lines. Yes, I know what they're asking me, but I also have to get the intent behind the question. Remember, every question measures a KSA, a knowledge, skill, or ability. Now, you guys happen to know that I'm really focusing on code of ethics today and this particular question. So the question says, in a rural community, you're the only Lcsw within 50 miles. A parent requests that you see both them and their teenage child separately for therapy. My hairs on my arms are standing up already. Oh, the parent discloses marital issues in their intake and later says, "Oh, but don't tell my child." The child discloses suicidal ideations in their intake and ask you not to tell the parent. The ethical course of action is to maintain strict confidentiality for each and separate clients, clarify limits of confidentiality at the onset and determine who you're treating. C, treat only the child as a minor discloses always overrides rights. And D, provide services to both but avoid documentation overlapping themes. Now, I want you to understand the NASW ethical decision making process. It really used to say seek supervision. And if you had an older professor, if you're working in a job that says that, remember, we do not need to seek supervision anymore. We do not. When it comes to the questions, I want you to understand all four of the answers. So I do know that it's an LCSW, it's within 50 miles, a rural area that matters. I understand that many times in rural areas that having more than one relationship happens, right? So understand all four of my questions. Maintain strict confidentialities for each of separate clients. Clarify the limitations at the onset and determine whether treating both parents is feasible given the potential conflict of interest. And I really want to make sure I understand all of them. So C, treat only the child as minors disclose often override parental rights. And D, provide services to both but avoid documentation. So A, again, we're looking at code of ethics, the KSA. So if I look at A, the problem is with that one is the parent's secrecy about the marital issues and the child's suicidal ideation kind of split my alliances. It violates my code of ethics. In a an area, a dual relationship is okay, but oh my gosh, mom's telling me her dirty, nasty secrets, and she's telling me about her kid. That again makes the hairs on my arm stand up. Oh, I don't like that answer. I don't like that answer. Let's keep going. If I look at B, B says clarify the limitations of confidentiality at the onset. Part of my informed consent, or the minute she asked me that question, I need to go over what's going on and determine whether or not treating both is even feasible. Because I know my code of ethics says I shouldn't treat both. I only get one choice. If the couple is my client, the whole couple is my client. If the family is my client, the whole family is my client. I'm not supposed to see a child and a mother separately. But I definitely know that it's a rule setting. So now I've got an ethical dilemma. Okay. So C says treat only the child as minor's disclosure always override parental rights. I hope I don't have to explain that to you, but we're going to rule that out. No, for the test, remember, minor is under the age of 12. I know that in your state, you may have different state rules, and you may have to take a jurisprudence test, and that's okay. But remember, the LM, the LC only focus on the code of ethics. If there's ever a question that says follow local and state guidelines, that's always the right answer, because that means that different states have different responses. But in general, for the test, we're going to follow the code of ethics, not my local laws. And D, of course, says provide services to both, but avoid documenting overlapping themes. Girl, we know better. We got to document We got to document everything, 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 everything. So even I go back and look at the questions, I can tell you this is not the right answer. We always have to document. If we don't document, it didn't happen. By the way, remember that you have the right to have a separate set of psychosocial notes. Oh, court order subpoenas, that freaks everybody out. But remember, your separate set of psychosocial notes don't exist. If the judge or court orders all of your records, unless anyone specifically looks at you in the face and says, Dr. Pam, do you have a separate set of records? They don't exist. I'm not going to lie to the court because Dr. Pam does not do well behind bars. No, no, no. However, they do not exist. So if it says release all records, it does not include my separate set of psychosocial notes. So now that I've understood all four of the choices, this is where we go next. What's the dilemma? What's the question asking me? It's a rural area. It's a small area. The Code of Ethics makes it very aware that in a rural area, dual relationships are often unavoidable. They really are. So if I'm the only therapist and there's only one auto mechanic and I'm seeing his family, I can't avoid that. I can't avoid that. Also, remember, bartering is acceptable in rural areas. Most often, the barterers are not poor. Please don't ever think that. If I own a cattle ranch, I'm not poor. And if we pay everybody the same way with my cattle, and you ask, the client asks, and it's the rule of the community, I cannot exploit him. That's the biggest issue. I can't take a whole side of beef for one session. I don't want you to ever forget the problem-solving method, though. It's an ethical dilemma. It's an ethical question. But remember, we get paid to be nosy. I'm thinking, even an ethics question, should I assess? Do I have all the information? What else can I gather? We get paid to be nosy. First, next, best. If I can assess, if I can gather more information, that's always, always my best choice. Now, remember in this question, also, it talks about my ethical dilemma. So if we could break it down, the biggest issue is the dual relationship. A conflict of interest focuses on money. Dual relationships talk about, I can only have one relationship with you. I can only be your therapist. I can't be your therapist and your hairdresser. I can't be your therapist and be your family's therapist. The conflict of interest includes money. If you're not sure about that, join me for a session or I'll try to do another video on that. The key principles is really about what's best for my client. And I want to make sure I don't hurt anybody. I don't need my supervision. I don't need supervision. I'm the best of the best. So as I go back, I'm going back to the question. The question asked me, do I understand the dilemma? Do I understand what I should do first? I've ruled out. I always go back to the question. Remember, I ruled out the last two because those just didn't make any sense at all. So if we go back to the original question, we're going to go back to understand what it asked me. It asked me about living in a rural area. It asked me about the LCSW. I'm an LCSW. So A was maintain strict confidence for each, because since they are each separate clients. And B was clarify the limits of the confidentiality at the onset. I ruled out C and D. C was treat only the child as a minor. No. And D said provide services to both, but don't document. That leaves me between A and B. And remember, I'm going to assess. So my best answer is B. Let's clarify the limitations at the onset and determine whether or not it's even feasible. Let me gather more information before I make any decisions. Guys, I hope that helped you answer the question. Subscribe to our channel. We definitely love to provide answers and questions to our social workers, LCSW by trade. If you look at our site, you may think that we only do LPCs or the mental health exam, but we are definitely here for social workers. We are very unique. We will never sell you a canned program. We're going to come up with a plan just for you. Invest in yourself. You are worth it. You are worth it. Take this test one time, one more time, and don't do this again. There's no reason to there's no reason to keep taking this test over and over and over again. I hope I see you in a live session with me, and be sure to subscribe to the channel. Bye, guys.